KMPDU and the Kenya Medical Association KMA today met with the members of the Senate Standing Committee on Health. This is days after the medics issued a 21-day strike notice, accusing the government of ignoring their grievances. Parliament tonight is seeking to play a part in averting the looming medics strike that could completely cripple the country's health system amid the ravaging coronavirus pandemic. David Mudoka has more.
Days after the Kenya Medical Practitioners and Dentists Union issued a 21-day strike notice, accusing the government of turning a blind eye on its frontliners in the fight against the coronavirus pandemic, members of the Senate Standing Committee on Health on Thursday met with KMPDU officials and their Kenya Medical Association counterparts. This as the Senate seeks to thwart the looming doctors' strike that could grind provision of health services in the country to a halt amid the surge in COVID-19 infections in the country. In the meeting that was held virtually, the health workers have, however, reiterated that their threat to strike will remain unwavered unless their plight is fully addressed by what they term as a government blowing hot and cold.
You have workers who are demotivated, who feel abandoned, and they can no longer continue offering services until at least there's an assurance that their lives will be taken care of, because now it's about our lives.
Likening their woes to those of a soldier at the center of a crossfire without armor, the health workers have said recent attempts to engage the government about their woes have repeatedly hit a dead end.
7th of June, I wrote to the CS Health, and at that time we had 84 healthcare workers infected with COVID-19. And with that, in the letter, all we were requesting for was a meeting to discuss occupational safety and health, which is the issues that are currently bedeviling us in COVID, and two, the welfare. And we just wanted to share the strategy that would help us work to avoid some of the things that we've seen. These letters have never been responded to, call for meetings, it's just been a cat and mouse game.
Medical statistics show that more than 20 health workers have succumbed to COVID-19 while on the line of duty, even as the situation rapidly worsens.
When you've lost 10 and 4 within a weekend, and if this situation continues, you will have no doctors to serve you.
The medics want provision of a comprehensive NHIF cover to all doctors, employment of at least 2,000 doctors on permanent and pensionable basis, payment of all applicable allowances to doctors working under the Ministry of Health, enhancement of risk allowances, provision of adequate and standard PPEs in all health facilities, immediate reinstatement of sacked Laikipia and Kirinyaga doctors, as well as a Constitutional Health Services Commission.
Easy.
You can't do that to your doctors and your health workers. It's not fair.
The meeting between health workers and the Senate comes a day after the former met with the National Assembly Committee on Health to chart a convenient way forward for strike-threatening medics in the country. David Mudoka, TV 47.